Hi, I'm Dr. Herb Cushing, Chief Medical Officer at Spectrum Healthcare Partners and Infectious Disease Specialist. Thank you for joining us for this segment of Leading by Example. Today, we'll talk a little bit about why it is safe to get healthcare and what healthcare practices are doing to control the spread of the coronavirus. Healthcare conditions often can't wait, and because they can't wait, doctors' offices in surgery centers and hospitals have put in place processes to protect you and to protect the staff at those institutions so that when you come in, we want to make sure that you're not at fear of getting infected with the virus and the staff are not in fear of getting infected from patients who come in. Let's talk about how you can decrease your anxiety levels as you begin to resume some normal activities in the month of May. Remember that the cases in the state of Maine are modest. There's still less than 1,000 cases total reported during the entire period of this outbreak in the state of Maine, and that's really good for a state with a population between 1 and 1.5 million people. So the transmission rate is really not that high for most areas where people spend most of their time. High-risk zones have included people who are in congregate living facilities like nursing homes and shelters, and there's been tremendous attention focused on making those areas safe by the CDC at the state level. So please don't hesitate to come in and get health care if you believe you need it. It really is safe, and we have special procedures in place to make sure that you're okay. If you haven't been to see a physician since the COVID outbreak, things will be a little bit different. There probably will be fewer patients going through the doctor's office at the same time, and that's okay. So you will not be asked to spend a lot of time sitting in a waiting room next to other people. We'll put a mask on you when you come into the physician office, and you'll wear that mask through the encounter. You'll meet other people in the office who are also wearing masks, and if you haven't seen this much in your doctor's office and you're used to seeing your doctor's face, it can be a little unsettling at first, but you'll get used to it and you'll still be able to communicate and they'll take good care of you. There are some patients who have immunocompromising conditions or who are older or have troubles with their heart, kidneys, or diabetes, and these folks have special needs. If they were to acquire the virus, they tend to get sicker than most other people will. Ask your physician's office before you go if they have special times when you can be seen or if they take any special precautions for you because you're in a high-risk category. Let them know that you're afraid of that, and I'm sure they'll accommodate you. Thankfully, the virus is not being transmitted as much as it was. There are still a few cases in the community and still a few being reported, and this may happen for weeks to come or may happen indefinitely where there are some cases being reported in the community. But it's still safe for you to begin to resume normal healthcare operations. Even though the peak of the virus has passed, we still need to maintain good social distancing, good masking, and wearing of personal protective equipment, especially in settings where you're with lots of other people and where the virus can be transmitted. Please remember that the primary way that this virus is transmitted is from person to person by droplets in the air when people are within 6 feet of each other and when they have to spend a prolonged period of time doing that. There is some transmission with casual passing by of folks walking down the corridor in a supermarket, for example, but that's not where the virus is mostly transmitted. Think about areas where you're at higher risk. You probably don't want to be at big gatherings still until it's deemed safe to do so by the CDC. You probably want to limit gatherings of the family still until you know when things are safe. Thanks for watching today. I'm Dr. Herb Cushing, Chief Medical Officer at Spectrum Healthcare Partners. If you would like more information, please don't hesitate to contact me. I look forward to answering your questions.